Good day everyone, I'm Hannah Maxine Cruz, a student nurse of Pamantasan ng Lungsod ng Pasig. And for today, our topic is neurodevelopmental disorders and we are the group 6. So, ang psychiatric disorders are not diagnosed as easily in children as they are in adults. So, alam naman natin na ang mga bata ay nagdadaan sa developmental stages at hindi agad nadadiagnose o nalalaman yung psychiatric disorders kapag ikaw ay bata pa. Hanggang sa ikaw ay maging matanda na, mas malalaman natin kung ikaw ay may psychiatric disorders. So, children usually lack the abstract cognitive abilities and verbal skills to describe what is happening. So, alam naman natin na ang mga bata ay hindi pa ganun kaayos yung pag-iisip nila kapag sila ay nasa below 4 years old or 5 years old. Meron naman na slow learner o tinatawag na hindi pa ganun kagaling umintindi ng mga sinasabi ng isang tao. So, nasa pagtuturo din ito ng bata dahil isang importante sa mga bata na matutunan nilang magsalita dahil tinitignan dito ang developmental stages ng isang bata. So, children and adolescents experience some of the same mental health problems as adults, such as the mood and anxiety disorders, and diagnosed especially with the same criteria as for adults. So, sabi dito, ang children and adolescents daw ay minsang nakaka-experience ng same mental health problems katulad na lang ng mood and anxiety disorder. So, hindi naman may iwasan na magkaroon ng pabagong-bagong mood ang isang bata at ng matanda. And ganun din sa anxiety disorders, siguro kapag bata is normal naman siguro ito kapag ikaw ay nasa below of age, lalo na kapag nahiwalay ka sa magulang mo o sa mama mo. And this chapter focuses on neurodevelopmental disorders, usually diagnosed in infancy or childhood and sometimes adolescence. Many of these disorders proceeds into adulthood. So, what is intellectual disability? So, it is the correct diagnostic term for what was called mental retardation. So, it is a term often used in disparaging manner to bully or ridicule individuals with impaired cognitive abilities. So, common ito sa mga batang may disorder na tinatawag na mental retardation. So, ano nga ba ito? Ito ay isang disorder na hindi ganun ayos yung kanilang pag-iisip. Meron din silang below IQ or tinatawag na intelligence quotient. And ang kanilang communication skills ay hindi ganun kaayos. Minsan nauutal-utal sila or kung ano-ano yung mga nasasabi nila sa kausap nila. And this disability is based on cognitive functioning, and the causes of intellectual disability include hereditary conditions such as the Tay-Sachs disease or the fragile X chromosome syndrome. So, pwede rin magkaroon ng early alterations in embryonic development such as the trisomy 21 or maternal alcohol intake. So, alam naman natin na kapag ang isang babae ay pregnant, bawal na bawal itong manigarilyo or uminom ng alak dahil maapektuhan ang sanggol sa sinapupunan nito. Katulad na lamang nitong sakit na intellectual disability. So, hindi maiiwasan yon kapag ikaw ay hindi healthy na mother. Kasi maapektuhan yung baby mo. So, mood and behavior disturbances vary among people with intellectual disabilities. So, some people are passive and dependent, or yung iba naman is aggressive and impulsive. And still others may have minimal mood and behavior disturbances. So, children with mild to moderate intellectual disability usually receive treatment in their homes and communities and make periodic visits to physicians. So, what is the autism spectrum disorder? So, it is the DSM-5, or the Diagnostic and Statistical Manual of Mental Disorders 5th edition. It is a diagnosis that includes disorders previously categorized as different types of pervasive developmental disorder, or DPDD, characterized by pervasive and usually severe impairment of reciprocal social interaction skills, communication deviance, and restricted stereotypical behavior patterns. Ang autism spectrum disorder, it is a formerly called autistic disorder or just autism. So it is a almost 5 times more prevalent in boys than in girls. And it is usually identified by 18 months and no later than 3 years of age. So, sabi dito, ang autistic or autism ay 5 times more prevalent in boys than girls. So, mas common siya sa mga lalaki kaysa sa mga babae. At na-identify ito kapag ikaw ay 18 months or no later than 3 years of age. Yung children with autism spectrum disorder have persistent deficits in communication and social interaction, accompanied by restricted stereotype patterns of behaviors and activities. So, these children may display little eye contact with and make new or facial expression. So, kapag may nakikita tayong may autistic or autism, napapansin natin sa kanila na masyado silang magaslaw or mayroon silang mga facial expressions na pinapakita. And hirap din silang makipag-communicate sa mga tao. And yung behavior nila kapag sila ay nagagalit is aggressive sila, nagwawala sila, nananakit sila. Pero yun ay normal lamang sa may sakit na autism. There can be little intelligible speech. These children engage in stereotype motor behavior such as hand flapping, body twisting, or head banging. So, alam natin na ang isang may autistic or autism ay kapag may ginagawa silang bagay or nag-iisip sila, minsan hinahampas nila yung ulo nila sa pader, or yung kamay nila is ipupukpok nila sa ulo nila. Ganun yung behavior ng may autism. Children with autism were usually treated in segregated, especially outpatient or school programs. And those with more severe behaviors were referred to residential programs. So, merong mga may autism na kaya pang bantayan or ipasok siya sa mga outpatient na clinic para antabayanan or tignan kung ano yung condition nila. Pero may mga tao kasi na malala na yung behavior nila, talagang nananakit na sila, so minsan pinapasok sila sa isang residential programs. So the goals of treatments of children with autism are to reduce behavioral symptoms, and it is to promote learning and development, and particularly of language skills. So kailangan talaga natin silang turuan, alalayan sa lahat ng mga bagay na kanilang susubukan katulad na nga lamang ng language skills. So, kailangan silang matutong makipag-communicate ng maayos sa mga tao. And, dapat din silang maturuan kung paano yung pakikipag-socialize sa ibang tao na hindi nananakit kapag nagalit sila. So, matututunan naman nila yon in the process. So, may mga pharmacologic treatment tayo na pwedeng ma-subside or mapababa kapag inaatake sila na sobrang wild na galit. Is meron tayong antipsychotics such as haloperidol, risperidone, aripiprazole, or combinations of antipsychotic medications. And that's all po for the autism spectrum disorder. Thank you!
Now, we're going to talk about related disorder. First is tic disorder. Pag sinabing tic, ito ay biglaan, paulit-ulit, mabilisan at irregular na movement or vocalization. May iba't ibang klase ng mga tics. Merong simple motor tics, kaya siya simple kasi isang muscle group lang ang involved. For example, blinking. Normally, every 4 seconds on average tayo nagbi-blink. Yung iba nga nagtatagal ng 10 to 15 seconds bago pa mag-blink. Pero sa mga may tic disorder, excessive yung blinking. Parang every second sila nagbe-blink. Yung ibang simple motor tics naman ay pumapalakpak. Shrugging of shoulder, head twitching, yung biglaang nagtitwist or turn yung ulo, paglabas ng dila, pagtaas ng kilay, at iba pa. Minsan subtle yung movements, hindi mo mahahalata na may tic yung kausap mo. Hindi limited ang tic sa head, pwede rin sa kamay, paa, or any part ng body na nagagalaw. Kung may simple motor tic, meron namang complex motor tic, meaning more than one ang muscle group na involved. Ito ay combination of simple motor tics na nangyayari at the same time. Pwede ring echopraxia. Ito ay yung hindi intentional na paggaya ng galaw ng kausap nila. Copropraxia. Ito naman ay ang paggawa ng obscene gestures tulad ng pagpapakita ng middle finger. Remember, lahat ng ito ay involuntary. Hindi nila sinasadya. Maliban sa motor tics, meron ding mga vocal tics. Simple vocal tics tulad ng pag-ubo, pagsinghot, pagsipol, pagsabi ng syllables tulad ng ha, at pwede ring paggaya ng animal sounds. Sa mga complex vocal tics naman, meron namang echolalia. Ito ay pag inuulit nila yung mga naririnig nilang sentences sa TV, movie, kanta, or kausap nila. Randomly lang nila sinasabi, hindi nila sinasabi with the purpose of communication. Palilalia naman, ito yung pag-uulit ng salita or sound. Coprolalia naman, ito yung pagsasabi ng bad words. Again, lahat ng ito ay involuntary, hindi nila sinasadya. Bakit nga ba may nagkaka-tic disorder? Ang exact cause is unknown, pero ito ay pwedeng namana. May genetic abnormality. May problem sa pag-regulate ng neurotransmitter na nagkokontrol sa pagpigil ng mga actions. Abnormal transmission of neurotransmitter dopamine is thought to play a part in tic disorders. May mga environmental factors din na pwedeng mag-contribute sa tic disorder, tulad ng infection or mga perinatal injuries. Maaaring may point na habang pinagbubuntis ay nagkulang ng oxygen dahil sa complications during pregnancy. Tics are usually treated with risperidone or risperdal or olanzapine o zyprexa, which are atypical antipsychotics. It is important for clients with tic disorders to get plenty of rest and to manage stress because fatigue and stress increase symptoms. Next is Tourette disorder. Ito ay isang uri ng tic disorder na kung saan may multiple motor tics and one or more vocal tics na nangyayari siya. Maraming beses sa isang araw for more than a year. The complexity and severity of tics can change over time. Reminder, magkakaiba ang tic ng bawat pasyente na may Tourette disorder. Yung iba, hindi mo mahahalata. Let's watch this video.
Hello! Help!
Which one? In regards to Excellent. And those look at protein structure and how it relates to function and enzyme catalysis. And we're only scratching. And we're only going to deal with the first and second and not the third. But energy used demonstrates release. Okay? Heat is released. That's going to increase here. Am I creating any kind of disorder or disturbance? No. Okay? And if I start doing this, okay? So we increase what we use S. Enthalpy. Enthalpy. You heard of enthalpy? Enthalpy. You think of enthalpy, you think of heat. Okay? Release. Okay? So whenever heat is released, that's going to increase class. You want to make
The person with Tourette disorder has significant impairment in academic, social, or occupational areas and feels ashamed and self-conscious. This is rare disorder, 4 or 5 in 10,000, more common in boys. 3 to 4 times more likely ang mga lalaki magkaroon ng Tourette kumpara sa mga babae and is usually identified by 7 years of age. 90% of the time, ang mga may Tourette disorder ay may comorbid conditions tulad ng ADHD or Attention Deficit Hyperactivity Disorder, pwede ring OCD or Obsessive Compulsive Disorder, at pwede ring anxiety disorder. Ang mga tics ay lumalala pag nakakaranas ng anxiety, excitement, or exhaustion. Pwede pa bang makontrol ito? Yes, through cognitive behavioral therapy, habit reversal training, at pagkontrol ng anxiety. Kanino dapat magpakonsulta? Sa neuropsychiatrist. Chronic motor or tic disorder. Chronic motor or vocal tic differs from Tourette disorder in that either the motor or the vocal tic is same but not both. Transient tic disorder may involve single or multiple vocal or motor tics, but the occurrences last no longer than 12 months. Next naman is learning disorder. Nadadiagnose ang isang bata with learning disorder kapag yung achievement in reading, mathematics, or written expression is below or mas mababa sa average that is expected for age, formal education, and intelligence. Yung reading and written expression disorders are usually identified in the first grade. Yung math disorder naman ay pwedeng undetected until the child reaches 5th grade. Approximately 5% of children in U.S. public schools are diagnosed with a learning disorder. The school dropout rate for students with learning disorder is 1.5 times higher than the average rate for all students. Common sa children na may learning disorders ang low self-esteem and poor social skills. Sa mga adults naman, nagkakaproblema sila sa employment or social adjustment. Early identification of the learning disorder, effective intervention, and no coexisting problems is associated with better outcomes. Children with learning disorders are assisted with academic achievement through special education classes in public school.
Now we're going to move on to motor skills disorder. So the first one that we have is the developmental coordination disorder. It is an impaired coordination severe enough to interfere with academic achievement or activities of the daily living. So with this diagnosis, hindi to applicable sa patients with medical conditions such as cerebral palsy or muscular dystrophy. A good example for this is pag yung bata is nasa edad na dapat, gumagawa na ng independent task, instead, nagtatry pa lang siya or yung patient mag-crawl or walk. So, hindi na akma sa age niya. With this diagnosis, yung patient is naapektuhan na yung daily activities niya as well as yung pag-aaral niya. So with this, the schools provide adaptive physical education and sensory integration programs to treat motor skills disorder. So, ano-ano ba yung mga adaptive physical education and sensory integration programs nila? So, the first one that we have is the adaptive physical education programs. So, dito naman sa program na ito, they provide activities that allows children to emphasize movement tulad ng paglalaro ng football or soccer, which allows them to kick and include movement in their activities. Next is yung sensory integration programs. So, This program naman ay physical therapies na nagfo-focus sa area or areas na need i-improve ng patient or kung saan siya nagkakaroon ng difficulties. So, example for this is if the child has difficulties in skinship or physical touch, yung therapy niya is magko-consist ng way para matulungan siya na mag-touch ng skin surfaces or makadevelop ng skinship. Next is we have our stereotypic movement disorder. It is characterized by rhythmic, repetitive behaviors such as hand waving, rocking, head banging, and biting that appears to have no purpose. Onset is prior to age 3 years and usually persists into adolescence. So, this disorder naman is like the tic disorder or yung Tourette syndrome na na-discuss prior to this topic. So, this is when di nila makontrol yung movement nila even if hindi naman necessary yung ginagawa na movement. Dito madalas nangyayari yung self-inflicted injury na bigla-bigla na lang nila i-hit or susuntukin yung sarili nila against their own will. In other words, hindi nila gusto yung ganun na behavior. So this disorder is common among individuals with intellectual disability as well as patients with anxiety, ADHD, OCD, and like I have mentioned, tics or Tourette syndrome. Next up is we have our communication disorders. So it involves deficits in language, speech, and communication and is diagnosed when deficits are sufficient to hinder development, academic achievement, or activities of daily living, including socialization. So, with this disorder, this is pretty much self-explanatory. These are disorders that affect an individual's ability to comprehend, detect, or apply language and speech to engage in a dialogue effectively with others. So, presented at the slide are the different communication disorders. So, the first one is the language disorder. So, this involves deficit or deficits in language production or comprehension, causing limited vocabulary and inability to form sentences or have a conversation. So, in this disorder, the child might be having trouble with using correct words to express, hirap mag-express ng iniisip and ideas, reciting poems as well as singing songs, and naming objects and asking questions. Next naman is yung speech sound disorder. So, it is a difficulty or inability to produce intelligible sounds or speech which precludes effective verbal communication. So, in this disorder naman, tayong nagre-receive ng message ay hirap sila maintindihan kasi they are not able to produce intelligible speech. So, they often leave off sounds from words na instead na school sabihin nila, ang sabihin lang nila, ku. And they also add sounds to words like saying play instead na sabihin nila yung word na play. After that is we have stuttering. So stuttering is a disturbance of fluency and patterning of speech with sound and syllable repetitions. So it can also be called as stammering. Oftentimes, people who suffer from this disorder is alam nila kung ano yung gusto nila sabihin pero di nila masabi or nahihirapan sila sabihin dahil nga dun sa repetitions of syllables. Lastly, we have our social communication disorder. So, this involves the inability to take turns talking and listening with another person. So, in this disorder, the person is unable to observe social rules of conversation. So, oftentimes, may inability silang magkwento in an understandable manner. So, hindi maintindihan ng receiving person. So, people who suffer from this disorder may have trouble understanding facial expressions, no eye contact, have little interest in social interactions, and katulad na nabanggit ko kanina, they talk over others while they are having conversations.
So now let's talk about the ADHD or yung Attention Deficit Hyperactivity Disorder. So itong disorder na to is characterized by inattentiveness, overactivity, and impulsiveness. It is a common disorder especially sa mga boys and accounts for more child mental health referrals than any other single disorder. It affects the school age with 60 to 85% having symptoms persisting into adolescence. So yung mga batang who are very active or hard to handle sa classroom can be diagnosed and treated mistakenly for ADHD. So itong mga batang to may suffer from psychosocial stressors at home, inadequate parenting, or other psychiatric disorders. So to avoid overdiagnosis of ADHD, a qualified specialist such as the pediatric neurologist or a psychiatrist must conduct the evaluation for the ADHD. So meron rin kasing ibang disorders na um, may look similar sa ADHD, katulad na lang ng bipolar disorder or yung behavioral acting out in response to family stress. So for the onset and clinical course of the children with ADHD, so usually identified and diagnosed when they begin preschool or school. Though may mga parents na nagre-report na mga problems from a much younger age, katulad na lang sa infants, they are hard to please and temperamental, and they have poor sleeping patterns. Kapag sa toddlers naman, they may be described as always on the go and into everything, so meaning active sila. Next, darts back and forth, jump and climb furniture, run through the house, and cannot tolerate sedentary activities katulad ng pakikinig sa mga stories. Next, when the child starts school, they fidgets constantly in and out of assigned seats and makes excessive noise by tapping or playing with pencils or other objects. Normal environment noises such as someone coughing or sneezing can distract the child. They cannot also listen to directions or complete the task, and interrupts and answers quickly before the questions are completed. Studies have shown that both teachers and peers perceive children with ADHD as more aggressive, fussier, and less likable. Thus, they may exclude the child from activities and play, may refuse to socialize with the child, and or may respond to the child in a harsh, punitive, and rejecting manner. And kapag tumuntong naman sila sa adolescence, dito na papasok yung discipline problems na serious enough to warrant suspension or expulsion from high school. Yung secondary complications naman continue to pose serious problems such as low self-esteem or peer rejection. So approximately 70 to 75% of adults with ADHD have at least one coexisting psychiatric diagnosis, with social phobia, bipolar disorder, major depression, and alcohol dependence being the most common. The definitive causes of ADHD remain unknown, but there may be cortical arousal, information processing, or maturational abnormalities in the brain. Combined factors such as environmental toxins, prenatal influences, heredity, and damage to brain structure and functions are likely responsible. Study have also shown prenatal exposure to alcohol, tobacco, heat, and severe malnutrition in early childhood increase the likelihood of ADHD. Although the relation between the ADHD and dietary sugar and vitamins has been studied, results have been inconclusive. So brain images of people with ADHD suggest decreased metabolism in the frontal lobes, which are essential for attention, impulse control, organization, and sustained goal-directed activity. Another study showed decreased blood perfusion of the frontal cortex in children with ADHD and frontal cortical atrophy in young adults with a history of childhood ADHD. Another study showed decreased glucose use in the frontal lobes of parents of children with ADHD who had ADHD themselves. Given the multifactorial nature of ADHD, abnormalities in catecholamine and possibly serotonin metabolism are associated with increased risk for ADHD. Despite the strong evidence supporting a genetic contribution, There are also the sporadic cases of ADHD with no family history of ADHD. And as you can see on the box na makikita nyo rin sa page 424, ito yung ginagamit na screening questionnaire for ADHD in adults. So we have here an example of nursing diagnosis. Ineffective role performance, patterns of behavior that do not match the environmental context, norms, and expectations. So for the nursing intervention, first we have to identify the factors that aggravate the client's performance. Rationale, the external stimuli that exacerbate the client's problems can be identified and minimized. Likewise, ones that positively influence the client can be effectively used. Next, provide an environment as free from distraction as possible, and institute interventions on a one-to-one basis, and then gradually increase the number of environmental stimuli. Next, engage the client's attention before giving instruction, such as calling the client's name and establish eye contact. The rationale behind this is that the client must hear the instructions as a first step toward compliance. Next, we can give instructions slowly using simple language and concrete directions, especially if they are complex or abstract, as the client's ability to comprehend instructions is impaired. Next, ask the client to repeat instructions before beginning the task, as repetition demonstrates that the client has accurately received the information. Next, separate the complex task into small tasks. The likelihood of success is enhanced with less complicated components of a task. Next, provide a positive feedback for completion of each step.
So to proceed to the next slide for the treatment of ADHD. ADHD is a long-term, chronic. So nakalagay dyan, di ba? ADHD is chronic. So, because it is a brain condition that causes the executive dysfunction, which means that it disrupts the person's ability to manage their own emotion, even thoughts, and action. So, with this condition, it makes it difficult because, syempre, mahirap yun di ba? After all, there is no cure in this disorder. However, there is management in this behavior. Like, there are standard treatments for ADHD that includes medication, education, some skills and training, and physiological counseling. There is also a medication, of course, that I mentioned earlier. So these treatments that I mentioned can help to manage the any symptoms of the ADHD. But ayun nga, it happens kasi when it imbalance the level of the neurotransmitters in the brain that causes that it does not work properly. So here the psychopharmacology, we have this the Ritalin. This medication is most common. These two is most common. Pero dyan sa book, there's a lot. No, parang 10, something like that pa yung use. But this is two are the common na ginagamit in this disorder. Has been used for the longest period of time that has been researched. No, it has been found to work well for the majority of the people with this condition. And this Ritalin stimulates the centers in the brain that underactive in the people with ADHD. Diba katulad nga ng sinabi ko na yung disorder nito, diba, they cannot manage their emotion, their thoughts. So, ayun yung target nung gamot na to. So, this medication helps to concentrate and helps the people to increase their attention span. Kasi nga, diba, may lang yung attention span nila and concentration. So, it helps them to stop acting on impulse without thinking. And this, the mechanism of action of this medication is to increase the
extracellular dopamine that blocking the DA or the dopamine nga in the transporters sa synapse. So, the next one is the Adderall. This is the brand name ng mixed of two stimulants, which is the amphetamine and dextroamphetamine. Both medication come into two forms, and it can be short acting and long acting. So this helps. Yung first medication, it helps to believe to yun nga, ang pinakaiba nilang dalawa, yung Ritalin, binablock niya yung reuptake ng dopamine and norepinephrine by the neurons. However, the Adderall, it blocks the reuptake dopamine at the synapse and acting as reuptake inhibitor. So, by this, so of course, every medication naman have side effects, and one of the side effects na taking this medication is loss of weight and parang weight loss of appetite. It because they increasing the activity of the neurotransmitter in the norepinephrine and dopamine in the brain, which it produces dopamine in the brain wherein nasosuppress yung appetite. So, nagkakaroon ng kasi it keeps the dopamine from being recycled and to metabolize. So, yun talaga yung yung side effect niya. So, just like to continue, just like what I said earlier, diba, the disorder can have problem nga, diba, sa nahirapan sila mag-manage ng thoughts, ng emotion. So, this disorder, it can affect also the children's learning and the social skills in the way how they communicate sa family nila. And, of course, one of them should understand yung strategies for home and school. Syempre, hindi naman pwedeng wala sila noon, diba? It does not cure, but it can manage. Syempre, it doesn't mean na if the client taking medication, hindi ibig sabihin nun na okay na. So, kailangan pa rin ng ng improvement sa academic performance, sa communication, sa mga taong nakapaligid sa kanila. So, it is according to the book, diba? Behavioral strategies are necessary to help the child to master the appropriate behavior, and also it includes the environmental strategies at school na they need help. And of course, hindi lang naman syempre yung patient, no? Of course, with the parents, of course, it is essential that we need to educate also the guardian nung bata or nung patient by helping them, no? Kasi it is crucial, but as well as na malaman natin yung strategy how to handle yung ganong disorder with it will be effective, diba? So, ayun nga, according to the book, one of the effective approaches, it include the consistent rewards and consequences for behaviors. Kasi nga, diba, maikli nga yung attention span. So, by rewarding them, it helped them, diba, to motivate to do the activity na pinapagawa or the therapeutic play, kumbaga. Yan. They can be offering consistent praises. Syempre, they will remind, diba, na tama yung ginagawa nila. Yan. And using time out. Yun nga, kasi nga, di ba, because of the kulang, disrupt yung attention span nila. Yun nga, using time out, diba? And giving verbal reprimands. So, it can be also yung positive and negative behavior. Syempre, dapat ma-reinforce. So, one of the therapeutic plays na ginagamit, nakalagay nga dyan, play techniques are used to understand the child's thoughts and feelings and to promote communication. So, yung laro, dapat, this not should be confused to play, no? Kasi nga, di ba, these techniques helps them to gain yung attention span nila. So, it's okay to, so dapat hindi confuse yung laro. So, one of the according to the book, yung mga dramatic play is acting out like the anxiety-producing situation that allows the child to be a doctor using a stethoscope, or other equipment to take care of the patient doll. And some play techniques are that available, yung pwedeng gawin is yung to release energy by it could be pounding pegs, running, working with the molding clay. At least it can be creative to express themselves. And by drawing pictures, family, peers, just like the other therapeutic play. So, these techniques are useful when the children is unable to or unwilling to express themselves verbally by get an example, drawing, ganun.
Okay, now so let's talk about the general appearance and motor behavior. To make it simple, here the child is aligaga or hindi mapakali. The child also cannot carry on a conversation because their speech is impaired and they usually can pay attention to what has been said. Next is the mood and affect. This one tackles how anxiety, frustration, and agitation are common. The child will appear to be driven to keep moving or talking. Thought process and content. No impairment on this area, but assessment may be difficult depending on the child's activity level and age. Next one is the sensorium and intellectual process. So in this state, the child's attention span may be a little as to 2 to 3 seconds with severe ADHD, while 2 to 3 minutes in middle forms. Even if assessing the child's memory, they may answer a lot with "I don't know," because they can pay attention that much to what you are saying. Next, judgment and insight. So as we all know, children with ADHD exhibit poor judgment. They may fail to perceive harm or danger and engage in impulsive acts. Next one is the self-concept. So in self-concept, it says here that children with ADHD has low self-esteem because they are not very successful at school and they don't have much friends, and usually gets out of place and may feel bad about themselves. While in roles and relationship, because the child may be disruptive and intrusive at home, it may cause friction with siblings and parents just until the child is diagnosed and treated. Parents often believe that a child is willful, stubborn, and purposely just misbehaving. Next is we're going to tackle the data analysis and planning. So nursing diagnosis commonly used when working with children with ADHD. It includes risks for injury, ineffective role performance, impaired social interaction, compromised family coping. So next is the outcome identification treatment. So outcome for clients with ADHD may include the client will be free of injury,
The client will not violate the boundaries of others. The client will demonstrate age-appropriate social skills. The client will complete tasks, and the client will follow directions. Now, as for the intervention, first, you must ensure safety because safety of the child and others is always the top one priority. Next is improve role performance by giving the child positive feedback to give them sense of accomplishments. Promoting a structured daily routine is also very helpful for teaching the child how to accomplish getting up, dressing, doing homework, playing, and also going to bed. Next is providing client and family education and support, including parents in planning and providing care for child with ADHD is important because parents feel empowered and relieved to have specific strategies that can help both of them and their child to be more successful. Okay, so for the overall evaluation, it is proven that improved sociability, peer relationships, and academic achievement happen more slowly and gradually but are possible with effective treatment. We're going to discuss the mental health promotion. Early detection and successful intervention are often the key to mental health promotion. Early identification and treatment of ASD are needed to help children with these disorders reach their maximum potential. An accurate diagnosis and appropriate interventions are more likely to produce the best long-term outcomes that are available.